Thyroid Awareness Month, and we're checking in with Dr. Carrie Kissel here at Hancock Health, an endocrinologist, because I think a lot of the things you're going to share with us can help people watching right now. This is an issue with your thyroid that could be more prevalent than people realize.
So 20 million Americans are affected by thyroid disease, so it's very, very common. And it affects women more so than men. So women are 5 to 8 times more likely to have thyroid disease than men, and especially after menopause.
So what should we be looking for? What are the symptoms? What are the treatments?
So there's no telltale symptoms of thyroid disease. So there's so many symptoms that women and men experience as a result of thyroid disease that are symptoms that we see with common ailments. So it's difficult to define what is specifically related to the thyroid. But when we think about an underactive thyroid or hypothyroidism, we're thinking about slowing down body functions. And so when we think about that from head to toe, we think people can get more fatigued, they can have depressed mood, they can have slowed digestion, they can have slow metabolism, and so have some unintentional weight gain. They can have problems with their menstrual cycles and even infertility. When we think of hyperthyroidism, we typically think of the exact opposite of that. So we're thinking of typically speeding up our body's body functions. And so those individuals can have anxiety, they can have difficulty sleeping, they can have unintentional weight loss or even tachyarrhythmia, so feeling like their heart is beating too fast. They too can also have problems with their periods and infertility.
When someone has those symptoms, maybe they're watching right now thinking, okay, what do I do next? What do you tell your patients?
Simply have that conversation with your doctor. Let your doctor know what's going on. Let him or her know what your symptoms are.
Once you identify the issues, what can be done in a situation where someone's thyroid isn't acting in the best way possible or the way it should?
So your doctor will start with a physical examination. So they start by looking at your entire self, but that does include your thyroid glands. Oftentimes we need lab tests and we need further imaging.
I know you've been studying this for many years, but I was just sharing with you, it feels like more now, thankfully, we're hearing more about health when it comes to your thyroid or hormone health.
Yeah, absolutely. It's thyroid disease is very common, and in the American Thyroid Association currently estimates that up to 60% of Americans are living with thyroid disease and not aware of it.
Wow, and that's certainly someone's going to be watching right now who is, and they maybe want to come in and talk to you more. What would you tell them for anybody that's just kind of wondering if they should talk to a doctor?
Absolutely. Go speak to your doctor about your symptoms, because there is so much overlap with thyroid symptoms and other common ailments. It can be difficult to decipher. So have that conversation.
Yes, and if they want to talk to you specifically, how can we get a hold of you?
Absolutely. You can find more information about myself and my fantastic Hancock Endocrinology team by going to hancockhealth.org/endocrinology. We are also partners with the Mayo Clinic and have their expertise available to us as well.
Dr. Kissel, thank you so much for talking to us and bringing awareness to this topic during Thyroid Awareness Month. We appreciate you.
Absolutely. Thank you.